She came in on a Tuesday morning in October. Her daughter had driven her because she didn't feel safe behind the wheel anymore. Margaret was 71 years old, a retired librarian from outside of Columbus, Ohio, sharp as anyone I have ever sat across from in an exam room. The kind of woman who read 3 books a month and could tell you the publication date of any novel you named. But something had changed. Over the past 2 years, she had started losing words mid-sentence. Not forgetting them completely. She could feel them hovering just out of reach, like she knew the shape of the word but couldn't land on it. She'd stopped driving because she twice missed turns on roads she had driven for 30 years. Her husband had passed the previous spring and she was living alone. Her cognitive testing came back normal, every single score within normal range. And yet Margaret sat across from me and said, "Doctor, I know something is wrong. I can feel my mind getting smaller." I am Dr. Pablo. I am a board-certified geriatrician with 18 years of clinical experience, specializing in cardiovascular and cognitive health in adults over 60. And what I told Margaret that morning is what I am going to tell you right now, because it is one of the most important and most overlooked conversations happening in medicine today. There is a single activity that research has shown reduces the risk of developing dementia by 76%, not 30%, not 50%. 76, and it is not running, it is not swimming, it is not lifting weights or doing crossword puzzles or taking a supplement. I'm going to explain exactly why this activity works the way it does, from the neuroscience to the biochemistry to the specific structural changes it produces inside the aging brain, and I am going to explain why most physicians, including excellent ones, never mention it. Not because they don't care, but because medical training does not prepare doctors to prescribe what cannot be written on a prescription pad. Before I get to the number one reason this works, and I am going to come back to it because it is the piece that will change how you think about your brain for the rest of your life, I want to give you the physiological foundation. Because without understanding what is happening inside the aging brain, none of what follows will make complete sense. After the age of 60, the brain loses roughly 0.5% of its volume per year. That sounds small until you understand what volume loss actually means at the cellular level. It means neurons are dying faster than they are being replaced. It means the synaptic connections between neurons, the pathways that carry memory, language, planning, and emotional regulation, are thinning. The hippocampus, which is the region of the brain most responsible for forming and retrieving memories, is particularly vulnerable. Studies out of Johns Hopkins have measured hippocampal volume loss of up to 2% per year in sedentary older adults. 2% per year. Over a decade, that is catastrophic. Over 2 decades, it is the difference between a person who remembers their grandchildren's birthdays and a person who no longer recognizes their face. But here is what the research has also made absolutely clear, and this is the part of the conversation that most people over 60 have never been told. Neuroplasticity, the brain's biological capacity to form new neural connections, to reorganize itself, to compensate for damage, does not end at 60. It does not end at 70. It does not end at 80. It slows, yes. The window narrows. But it remains open. And the question is not whether your brain can still change. The question is whether you are giving it anything worth changing for. That is where the activity comes in. That is where the data becomes impossible to ignore. The Albert Einstein College of Medicine conducted one of the most rigorous long-term studies ever done on lifestyle factors and dementia risk. They followed nearly 500 adults over the age of 75 for more than 2 decades. They measured everything: reading, crossword puzzles, cycling, swimming, walking, playing musical instruments, doing housework. Reading reduced dementia risk by 35%. Crossword puzzles 4 days a week reduced it by 47%. Swimming, cycling, and walking produced almost no measurable reduction in cognitive decline. Almost none. And that finding confused a great number of people, including a great number of physicians, until you understand the mechanism. Because the mechanism explains everything. Walking on a flat surface does not require your brain to learn anything new. Your cerebellum, the structure at the back of your skull that coordinates movement, runs the motor pattern automatically. It has been running that pattern since you were 14 months old. Your prefrontal cortex, which handles planning and decision-making, is essentially offline during a routine walk. Your auditory cortex is not engaged. Your limbic system, which processes emotion and social connection, is quiet. The brain is present, but it is not working. And a brain that is not working is a brain that is not growing. Dancing reduced dementia risk by 76%. more than twice the benefit of the next best activity measured. And the reason is not mysterious once you understand what dancing demands of the brain simultaneously. Every time you learn a new movement sequence, 6 distinct neurological regions activate at the same time. The basal ganglia, deep clusters at the base of the brain, responsible for encoding motor memory. The cerebellum, coordinating smoothness, precision, and balance. The kinesthetic cortex, updating the brain's real-time map of where your body is in space. The auditory cortex, processing rhythm, tempo, and musical phrasing. The limbic system, responding to the emotional and social experience of moving with other people. And the prefrontal cortex, making split-second decisions about what comes next when the music changes or a partner leads you somewhere unexpected. 6 regions, simultaneously. No other human activity has been shown to activate that combination at the same time. Not chess, not surgery, not playing a musical instrument. The cognitive load of learning and executing a new movement pattern to live music in real time with another human being is the single most neurologically demanding thing a person can voluntarily choose to do. And the brain responds to that demand exactly the way a muscle responds to resistance. It grows. Now here's the piece I told you I would come back to. The piece that most people miss entirely. There is a clinical state that sits between normal aging and early dementia. Neurologists call it subjective cognitive decline. It is the zone where a person notices changes, words slipping, names disappearing, familiar routes feeling uncertain, but their formal cognitive testing still comes back normal. Margaret was in that zone. And research published in the journal Neuropsychologia and confirmed by follow-up work out of Kyoto University has identified this window as the single most critical period for intervention. The damage is not yet structural. The neurons are stressed but not dead. The connections are weakening but not severed. This is the moment when the right input can reverse the trajectory. And dancing during this period has been shown to function not just as prevention, but as genuine neurological rehabilitation. Researchers found measurable improvements in hippocampal volume in adults over 65 who participated in regular structured dance over an 18-month period. Improvements that did not appear in the walking group, the stretching group, or the cognitive training group. The hippocampus was actually growing in people in their late 60s and 70s because the brain was being given a reason to. Margaret started a beginner line dancing class at her community center 6 weeks after that October appointment. She went twice a week. By the following spring, she called my office, not to schedule an appointment, just to tell me something. She said the words had come back. Not all at once, not overnight, but gradually, steadily, the way a fog lifts after sunrise. She had been driving again for 2 months. She had started a new book club. She was not the same woman who had sat across from me in October and told me she could feel her mind getting smaller. She was something else. She was someone moving forward. I want to talk now about what dancing does below the neck, because the neurological benefits are only one part of this story, and what happens to the aging body structurally is just as important and just as underappreciated. The spine. I need you to understand one foundational fact about your intervertebral discs, the cartilage pads that sit between each vertebra and act as the spine's shock absorption system. Those discs have no direct blood supply. None. They cannot receive nutrients the way muscle tissue does, through circulation. They receive nutrients entirely through a process called diffusion, and diffusion only happens through movement. When a disc is compressed and then released by spinal motion, it pushes old fluid out and draws fresh, nutrient-rich fluid back in. Every time. Like a sponge being squeezed and released. That is how your discs stay hydrated. That is how they stay resilient. If you sit for 8 hours a day, and the average American adult over 60 does, your discs are not being compressed and released. They are being compressed and held. The fluid is not being exchanged. The disc slowly dehydrates, stiffens, loses its ability to absorb shock. That is not a metaphor. That is the actual mechanism by which disc degeneration begins. Not from overuse, from disuse. Dancing produces a quality of spinal movement that no single physical therapy modality can replicate across all 3 regions of the spine simultaneously. The full body wave, a movement you find in West African traditions, in contemporary styles, in hip-hop, begins at the cervical spine in the neck and rolls sequentially down through the thoracic spine in the mid-back and through the lumbar spine into the sacrum. Every segment flexes and extends in sequence. Every disc in the spinal column is being compressed and released in a single continuous motion. The ligaments are mobilized. The paraspinal muscles, the long muscles running alongside the vertebrae, release their chronic tension. The deep stabilizers re-engage. Running alongside those vertebrae, on either side, are the sympathetic nerve trunks, part of the autonomic nervous system, the system that governs your heart rhythm, your digestive motility, your blood pressure regulation, your kidney function. When the spine is chronically immobile and compressed, signal transmission through these nerve chains becomes impaired. Not in a way that shows up dramatically on any single test, but steadily, cumulatively, over years. This is part of the clinical explanation for something I observe constantly in practice. Patients with chronic back pain who also have irritable bowel symptoms, or blood pressure that swings unpredictably, or cardiac arrhythmias that appear without obvious structural cause. The spine is not just a structural column. It is a conductive system, and restoring its mobility restores its function. Let me talk about your joints, because there is a myth I hear in my exam room at least 4 times a week, and it is genuinely causing harm. The myth is that movement wears joints out. It does not. Inactivity wears joints out. Incorrect, repetitive, high-impact movement wears joints out. But the absence of movement is one of the most destructive things you can do to your cartilage, and here is why. The cartilage inside your joints, your knees, your hips, your shoulders, is nourished by synovial fluid, a lubricating fluid produced by the joint's inner lining. But synovial fluid is only produced in meaningful quantities when the joint is loaded and moved. No movement means no fluid production. No fluid means the cartilage is essentially starving, and cartilage that is chronically undernourished begins to thin, soften, and crack. That is the mechanism of osteoarthritis in sedentary people. It is not a consequence of age alone. It is a consequence of a joint that stopped being asked to do its job. Now here's what makes dancing therapeutically unique for joint health, specifically for the knee. Nearly every dance tradition that has roots in Latin America, the Caribbean, or West Africa incorporates a soft, continuous yield in the knee. The knee never fully locks in extension, never snaps straight. From the outside, this looks like a bouncing quality, an aliveness in the step. From a biomechanical standpoint, it is something specific and important. When the knee locks straight and a footfall hits the ground, the impact force travels directly upward into the articular cartilage of the knee joint. Thousands of repetitions of that pattern over years and decades is how you get bone-on-bone deterioration. When the knee absorbs each step with a slight yield, that impact force is transferred to the quadriceps and the hamstrings, the large muscles of the thigh. The cartilage is protected. That is the difference, quite literally, between a knee that functions at 85 and a knee that has been surgically replaced at 64. I want you to hear about Thomas. 67 years old, retired high school football coach from outside of Nashville, came in with bilateral knee pain that had been worsening for 3 years. He had been told by 2 orthopedic surgeons that he was a candidate for knee replacement. He was not ready. He was still coaching youth flag football on weekends, and the idea of stopping, of stepping back from the one physical thing that still connected him to his former self, was not something he was willing to accept. We talked about his movement patterns. He walked 4 miles a day on concrete, heel striking, knees locking with every step, no variation in terrain or pace. I referred him to a physical therapist who also taught Caribbean social dance. Within 5 months, Thomas's knee pain scores had dropped by nearly half. He deferred his surgical consultation by 18 months. The cartilage had not regenerated. Cartilage does not fully regenerate. But the synovial environment had improved, the inflammation had decreased, and the muscles supporting the joint had become strong enough to protect it. He was still coaching. He told me the hardest part was learning not to feel ridiculous moving his hips in a dance class. The second hardest part was admitting it was working. The hip and pelvis deserve their own conversation because what is happening there in most adults over 60 is both widespread and underaddressed. The iliopsoas, a deep muscle that runs from your lumbar vertebrae through the front of the pelvis and attaches to the femur, is chronically shortened and contracted in almost every person who spends significant time sitting. When this muscle is in chronic spasm, it pulls the lumbar spine forward and downward, creating a continuous low-grade compressive stress on the lower back. This is not something most patients are told. They are told they have disc degeneration, or lumbar stenosis, or facet arthropathy, and they receive injections or surgery, and the underlying cause, a muscle that has been sitting in contracture for 15 years, is never addressed. Hip rotation, the movement that looks expressive in salsa or in West African traditions, is from a clinical standpoint a direct mobilization of the iliopsoas and the internal hip rotators. Done regularly and consistently, it gradually releases that chronic contracture. The lumbar spine comes out of compression. The paraspinal muscles can finally relax because the deep hip is no longer pulling everything forward and down, and the pelvis does not exist in isolation. The pelvic floor, the hammock of muscle tissue at the base of the pelvis that supports the bladder, bowel, and reproductive organs, is intimately connected to the hip rotators and to the iliopsoas. When the entire pelvic complex is chronically tense and immobile, the downstream effects are extensive. Bladder urgency, constipation. In men, pelvic pain that gets diagnosed as prostatitis when it is actually myofascial tension. In women, symptoms that have been present for years and attributed to aging, when the true cause is a pelvic structure that has not been asked to move freely in a decade. There is also something specific I want you to notice if you try hip rotation for the first time. One side will move easily. The other side will feel blocked, stiff, almost foreign. That asymmetry is not random. It is the accumulated record of your postural history. One-sided sitting, an old ankle injury that quietly altered your gait, a tendency to bear weight on one leg when standing. The restricted side is the side that needs the work. Not painful work, not forced work, but consistent, patient, persistent work in the direction that feels blocked. That is the actual rehabilitation, not the side that moves freely. Now I want to speak to something I do not hear discussed enough in cardiovascular medicine as it relates to adults over 60, and that is bone density. After menopause, women lose between 1 and 3% of bone mineral density per year without intervention. Men experience a slower but equally real decline beginning in their mid-60s. The standard prescriptions are calcium, vitamin D, and weight-bearing exercise. What is rarely specified is that the most effective weight-bearing stimulus for bone is not linear. It is multidirectional. The osteoblasts, the cells responsible for building new bone tissue, respond to mechanical stress, but they respond most powerfully to mechanical stress that comes from varied directions, at varied intensities, at varied tempos. Dancing provides exactly that stimulus. Your body bears weight at different angles, shifts from one leg to the other, absorbs impact at varying tempos, moves through diagonal and lateral planes that walking and running never touch. Research has shown that regular participation in dance activity can slow bone density decline by 20 to 30% in postmenopausal women and in men over 60. 20 to 30%. That is the difference between a fall that results in a hip fracture, with all of the mortality risk that carries, and the data on 1-year mortality after hip fracture in adults over 70 is sobering, and a fall you stand up from. Before I tell you exactly what I told Margaret to do, and what I am recommending to every patient in my practice who is over 60 and concerned about their brain, I want to ask you something. Drop a comment right now and tell me your age and where in the world you are watching from. I read every single comment on this channel, and the geography of this audience continues to surprise me. I want to know who is in this conversation with me. Now, the neurochemistry, because this is the piece that explains why dancing produces results that no other intervention, including medication, can fully replicate. When you move your body rhythmically to music you enjoy, your brain simultaneously releases dopamine, serotonin, and endorphins. Dopamine is the neurotransmitter of motivation and reward. It is what makes an activity feel worth repeating. Serotonin is the primary regulator of emotional stability. Chronically low serotonin is the biochemical signature of depression and anxiety. Endorphins are the brain's internally synthesized analgesic compounds, responsible for the subjective feeling of physical and emotional well-being that follows sustained movement. This is the precise neurochemical combination that antidepressant medications are designed to approximate. The difference is that medications carry side effect profiles, tolerance development, and discontinuation syndromes that I manage in my practice every single week. Dancing produces the same biochemical state through a mechanism the brain recognizes as completely native, and it does so without a single adverse effect. Research has shown that a single 45-minute dance session reduces circulating cortisol, the primary stress hormone, by between 25 and 40%. Cortisol matters clinically in a way that goes beyond stress management rhetoric. Chronically elevated cortisol directly damages neurons in the hippocampus. It suppresses T-cell-mediated immune function. It dysregulates the HPA axis, which governs your inflammatory response, your sleep architecture, your hormonal balance. Lowering cortisol by 30% in a single session is not a wellness outcome. It is direct neuroprotection and direct immune support. There is also a concept that neurologists refer to as cognitive reserve, sometimes called neural reserve, and it is one of the most clinically significant factors determining how well the aging brain weathers structural damage. Cognitive reserve is essentially the brain's buffer capacity. The more neural connections you have, the more redundant pathways exist, the more damage the brain can sustain before functional decline becomes visible. People with high cognitive reserve have had dementia-associated pathology, amyloid plaques, neurofibrillary tangles, discovered on autopsy who showed no clinical symptoms of dementia during their lifetime. Their brains had enough reserve to compensate. Research published in the European Journal of Neuroscience has identified dance as one of the most potent builders of cognitive reserve across the lifespan, and particularly in the decade between 60 and 70. When the window for building that buffer remains meaningfully open. So let me give you something specific, because telling you that dancing is good for your brain is not enough. Here is what the research and my clinical experience actually support. You do not need to become a dancer. You do not need to perform. You need 2 sessions per week of 30 to 45 minutes each, for a minimum of 12 consecutive weeks before the neurological changes become measurable. The activity needs to involve learning, not repeating the same 3 steps you already know, but consistently encountering new patterns, new sequences, new combinations. The learning is the medicine. The novelty is the mechanism. A beginner class in any structured social dance form, ballroom, line dancing, salsa, swing, even structured folk dance, provides all of this. So does following along with a structured online class 3 times a week, provided you are consistently learning new material. If you have significant joint limitations, the movement can begin seated. Research on seated dance therapy in adults with severe mobility restrictions has shown measurable improvements in cognitive function, mood, and autonomic regulation. Because the upper body, the arms, the torso, the head, the rhythm, all of it still engages the same neural architecture. If balance is a concern, which it is for many of my patients over 70, you begin at a wall or a bar or seated, and you work gradually toward unsupported movement over weeks and months. The balance improvement will come. It is one of the documented outcomes of regular dance practice in older adults. Measurable reductions in fall risk, measurable improvements in postural stability, because the cerebellum is being trained every single session. Margaret, the retired librarian from Columbus, still calls my office every few months. Not as a patient, her health is stable and her cognitive testing continues to come back normal, but to tell me things. She told me last spring that she had performed in a community dance showcase. She had choreographed her own piece. She was 73 years old, had been dancing for 2 years, and she stood on a stage in front of 200 people and moved her body through a sequence she had created herself. And there was not a single word she could not find. I want that for you. Not the stage necessarily, not the performance. I want the clarity. I want the mornings where the words come easily. I want the moments when you walk into a room and remember why you came. I want the evenings when you feel tired in the right way, the way that comes from a body that has been genuinely used and a brain that has been genuinely challenged. You are not past the window. The research is unambiguous on this. The brain you have right now, today, is still capable of growing, still capable of building new connections, still capable of surprise. But it needs a reason. It needs novelty. It needs the complexity of learning something your body has never done before, set to music, in rhythm, with your full attention. That is not a prescription I can write on a pad, but it is the most evidence-supported recommendation I can give you. And it is the one I want you to take seriously. If this conversation reached you, if something here landed, please share this with someone you love who is over 60. Subscribe to this channel because this is the kind of medicine I intend to practice here. The kind that tells you what the data actually says, in language you can use, before the system catches up. I will see you in the next one.